The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is Dr. Thomas O'Brien. For almost 25 years, I specialize in offering families an affordable concierge service to avoid paying costly medical insurance or unreachable deductibles without giving up premium health care. As an osteopath, I offer osteopathic adjustments alongside medical examinations. Also, I offer discounts to military and first responders. I am now accepting no-fault patients, which include osteopathic adjustments, medical treatments, and prescription services, including medical marijuana. At my practice, my patients never pay co-pays and still receive the most personal and complete medical care. I have spent my career devoted to providing healthcare at affordable prices. Everybody should have a relationship with their physician. I work for you and your family. The honor and privilege is mine. If you have been in an automobile accident, please call my office at 631-980-8200 for an immediate appointment. To learn more about me and my practice, visit drtomio.com. Again, I am accepting no-fault patients. Call my office for an immediate appointment, 631-980-8200. Welcome to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice which allows you access to the quality care you really deserve. With no rush office visits, both you and I can take our time and discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. I look at you when you're speaking, I listen to what you're saying, and I feel you both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. If you're involved in a motor vehicle accident, call my office today and schedule an appointment to have an osteopathic evaluation. To my military family, I got your six. To my Masonic brothers, the light is bright. If you wait, it may be too late. Today's topic, depression. But before we get into today's topic, I'd like to reintroduce Sammy Vanni.
Hi, Dr. O'Brien.
How are you today?
I'm good, doing good.
All right. I'd like you to, come back because you're going to do an internship with me here. You did a fantastic job. What was it, about 3 months ago you were on the show?
Just about.
Yeah. So the response was phenomenal. So, that's why I offered, come back. Let's have fun again. And because you're looking, to get into the marketing field.
Yes.
So this is a good opportunity to feel it out and see if this is what you really want.
So far, so good.
Okay. So you go to school locally?
Yes, I go to Malloy College. I'm a senior right now. Be graduating in a few months, and hopefully I find a job right after.
That's right. Well, this is going to be going out on your resume, so it's important, a new experience. All right, so we're going to talk about depression, and we can talk about, you can mention some, any experiences that you've seen and with your generation on campus. I know there was definitely a difference between my generation and your generation. The percentages of depression or those who suffer with a behavioral condition, there is a difference. So before we get into that, let's get into defining depression. According to the World Health Organization, depression is a common mental disorder. Globally, it is estimated that 5% of all adults suffer from the disorder. It is characterized by persistent sadness and lack of interest or pleasure in previous rewarding or enjoyable activities. It can also disturb sleep and appetite. Tiredness and poor concentration are common. Depression is a leading cause of disability around the world and contributes greatly to the global burden of disease. The effects of depression can be long-lasting or recurrent and can dramatically affect a person's ability to function and live a rewarding life. Depression is associated mental disorders and can have a profound effect on all aspects of life, including performance at school, productivity at work, relationships with family and friends, and the ability to participate in community activities. So Let's go over some of your experiences that you've seen on campus. It's with me. I'll go over my experiences, but what about yours?
So as a senior right now, looking over everyone and all the younger kids that go to my school, especially someone who's seen it firsthand, it's definitely difficult, especially for college students and especially women in today's day and age with social media and everything going on in the world. Mm-hmm. So it really takes a toll on a person, and I've seen it take a toll on a person. And it really, people try to suppress the feeling with things that they think will make them happy, but it never works. But it does definitely, it takes a lot out of a person, and it's hard to see that.
Exactly. Yeah, exactly. Oh, so let's, since you mentioned something there, let's go over defining it. Like I gave a background, but let's talk about medically. Someone who comes in and saying, I have depression. Well, I have to determine if an individual has actually depression or are they depressed-like syndrome, okay? Like sound slimmer, or what we call the blues, okay? The blues. So what is depression, like the signs and symptoms? Depression, it's someone who's experiencing hopelessness, helplessness, a feeling of poor self-esteem, as well as they are thinking about suicide, contemplating suicide, or wanting to hurt someone else. So that is the difference, where if someone is lacking the suicidal ideology, then that would be considered the blue-like syndrome. But if they are contemplating and actually writing down a plan of having a suicide, then we're talking depression. If they don't, that would be blues-like syndrome. And we need to be able to differentiate that. And as a physician, when someone comes in, I need to ask certain questions because I need to know their mindset. So, in your opinion, what do you think? Is there a test? Can you test someone for diabetes? For depression. There we go. That's another topic. Okay, we're live today, so you're going to hear errors.
So I believe that, so I've seen from a classmate, she went into a doctor and she decided to get medical assistance for her depression and also mood disorder. And I saw her and she told me that they asked her a bunch of questions, not really specific ones, just plain and simple ones. And they diagnosed her with mood swing disorder and depression. And they put her on these specific medications and it completely changed her, or she felt like it completely changed her. And it made her do something that she didn't want to do. But I believe that if someone is going to be diagnosed with it, it needs to be more specific than it is now. And there definitely is a difference between actual depression and people saying that you have depression.
Right, exactly. So, is there blood tests? No. Okay, no. Is there a diagnostic test? No. It boils down to the interview skill of the physician. Okay. Now this is, I'm going to go, we have a little less than 3 minutes, but this is something important. One of my best rotations I had as a medical student was with, in psychiatry. Okay. I had to do 5 weeks, and that was a part of our core, 5 weeks, psychiatric rotation. And I was in Erie, Pennsylvania at Hammett University Hospital. And it turns out that the attending grew up on Long Island and he graduated from Stony Brook Medical School. SUNY Stony Brook. And so once we made that connection, so I went from Long Island and I, studied at your library while I was preparing for my MCATs. We had that instant bond. And he says, okay, I'm going to teach you about psychiatry. So I'm looking to specialize in family medicine. And he goes, good. Well, I'm going to show you something. So he goes, come with me and I want you to sit here for an hour. And he put in tapes. And I go, what I want you to do is write down what you see on the screen and I'll come back and we're going to discuss it. And so basically, I had to look at the individual. I'm looking at the volume, the amplitude, the body language, the eye contact, and this was teaching me interview skills. And when he came back, we discussed this, and he says, this is what a psychiatrist is. It's all about the interview skills, okay? Anyone, I keep saying this, anyone can prescribe medication. When you come to my practice, I'm looking at you, I'm listening to you, and I'm feeling you both physically and emotionally. And that's where I learned those skills. Psychiatrists, and if they know theirs and they have really, really good skills, they do extremely well because that's their business. There's no tests, okay? It's not like I can send out some blood work and come back, oh, yes, you have depression. Now, it is, or I'm going to send you for an x-ray. No, what it is interview skills, and you have to have good interview skills. That means it's not a 5-minute visit. Yes, you're gonna answer those questions. Okay, we have the behavioral test quizzes, and we're gonna look at the number, and based on that number, we determine your behavioral the scale and say, okay, you have depression or not, or you have some other mood disorder. Based on that, we will make a decision on how we're going to treat the individual. And it's so important to be able to diagnose properly and then treat properly. All right, so we got 30 seconds left, so we'll close out the first half of the show. I want to thank everyone. This is my year anniversary. I want to thank all my listeners for listening to the Ask Dr. Tommy O show. So if you want to become my patient, I always tell you my patients are my family. It's look, listen, and feel both physically and emotionally. You must address all those issues, okay? Address all those so we can get to the bottom point, the bottom line, where we can discuss your health. So to learn more about my practice, go to drtommyo.com. That's drtommyo.com. Welcome back to the Ask Dr. Tommy O show. I'm your host, Dr. Thomas O'Brien. I offer a very affordable concierge practice which allows you access to the quality care you really deserve. With no rush office visits, both you and I can take our time to discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. I look at you when you're speaking, I listen to what you're saying, I feel you both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. Call my office today and schedule a history and physical. By the way, if you're involved in a motor vehicle accident, I accept no-fault patients. Come on in, schedule an appointment for an osteopathic evaluation. All right, so today's topic is depression, and my co-host, so we're doing the internship, is Sammy, Vanni.
Hi.
All right. So we discussed depression. We covered a lot of information in a very short time. And we left off with some of the signs and symptoms and how I learned to improve my interview skills. Because it's a skill set, and that's so important that every provider, every physician needs to master. We also just started to discuss having side effects with medications and being prescribed the appropriate medications. So let's go through that one more time, because you said you had a classmate that was seeing a provider and was given inappropriate medications.
Yes, so I have seen it before with one of my classmates. She sought help from somebody and with no knowledge of what she was doing, and she ended up getting prescribed these medications, and it turned her into somebody that she wasn't when she thought that they were helping. She thought that the medication would make her feel better, but in all honesty, she said that it just wasn't helping her, and it made her feel like someone that she wasn't. Right.
Now, you said describe when they spoke to you about the type of office visit. What type of office visit was it?
It was a very cold office. Everything was, she told me that it didn't look right to her. And the doctor that prescribed her the medication and interviewed her, she said it was more of a job interview than a doctor interview. You go see Tommy O, and he is like the family that you never thought that you could have. And he makes you feel like you are one of the best patients in the world. And she told me that this other doctor that she went to go see, it was cold and uninviting. Right.
Well, again, for me, I treat my patients like family, and it's not a one complaint, 5-minute office visit. I spend quality time with my patients. You need to, really care and embrace your patient. I need to know and understand what your mindset is. How am I going to make a decision if I don't understand you? So you need to understand. If 5 minutes, my greeting is 5 minutes. I'm giving you hugs, and
I always know to clear my schedule when I have to go see Dr. O'Brien.
Exactly. 5-minute offices with me. Sometimes, did we cover what you wanted? No, it's so important. The interview skill is so important because now we're going to go into misdiagnosis. Okay, so depression, there's subcategories. I'm a family physician, and I remember in the early '90s when we had the first generation SSRIs that came out, serotonin reuptake inhibitors, and that was Prozac, and they started prescribing. They made it seem that it was very, very easy to prescribe this, and they were really encouraging primary care physicians to prescribe this. Well, we have very minimum amount of training. I had more training than others because I was part of my school's program. In order to graduate, I had to do 5 weeks of psychiatric rotation. Other than that, I wouldn't have learned those interview skills. So now, if you don't have that skill set, how am I going to determine the subcategories of depression? Because depression is just not depression; it's other forms of behavioral conditions. We have what's called depression. Okay, then you have mania, and then we have bipolar, and there's others subcategories. So they made it seem, and I say they, I'm talking about the pharmaceutical reps, where one pill fits all, and it's not the case. We found out. Okay, before I get that. Pharmacology 101, first statement out of the doctor's mouth. Okay, there's 200 students in the amphitheater, and the physician said, and this is 32 years later, they said that all drugs are poisons. We control the poison for specific function. When we heard that, the 200 students, quiet. We're like, what is it? What are you talking about, poison? No, doctor good, doctor prescribes, therefore the medicine is good. No, that's not the case. They're poisons, and we just control the poison for a specific function. So you have to be very, very careful because of the side effects, the complications, the interactions with other medications. So if you have a quick 5-minute office visit, there's no way you're going to be able to determine if this is the right medicine or correct diagnosis and correct medicine for that if you need medicine, okay? Because sometimes you don't need medicine. Sometimes you just need a hug, and you need an empathetic and sympathetic ear and listen, and then we'll work on coping mechanisms. And that's not medication. That's spending time and examining and listening to your patient. So now we have the first generation SSRIs, and they were prescribing it to patients that have mania. Now, mania are individuals that are hypersensitive, and they are already hyped up. And then they were giving and prescribing an SSRI, and that was pretty much bringing them to the limit. And a lot of patients committed suicide because they just couldn't tolerate. They were very agitated, and they just couldn't control it anymore. So that's why you have to be very, very careful with medications. All right, so now let's talk about college campus. You said we're seeing record numbers of depression with your generation?
Depression with my generation, the numbers just keep going up and up. And it's really sad to see because we're in our 20s, mid-20s. We're supposed to be the happiest people in the world, living our best lives. And you just see the numbers of depression going up for people our age. We don't know how to handle, or we weren't prepared to handle college, jobs, and everything else that's going on in the world, just on top of COVID going on with everything that's happening outside of that. And it's really difficult to see, and nobody knows how to handle it anymore. And it's honestly hard. It's hard being in college and dealing with everything. We don't know how to handle all of it.
Right. Well, that's why, you have parents. Hopefully you have a good relationship with your parents, and they can help you and build those coping skills. Parent, okay, family. It's tough. You need your parents to help teach you. And that means they need to have developed good coping skills as well to pass it on. It's tough when you have kids having kids because you haven't even developed your own coping mechanisms. And then how are you going to educate your children on, because you didn't develop. So I can only educate you for what I know. So I'm fortunate. My wife and I, we're both, she's my baby cakes. I love you. There you go. Make sure I said that. She's a CPA, as well as you guys know, I'm a physician. So we spend a lot of time, and we're fortunate that we were able to give that extra time, with our children and make sure they develop the coping mechanism. And thank God, Jelly Bean, she's getting ready to graduate PT school. She has 10 more weeks, and then she'll be have a doctorate in physical physical therapy. Cookie, she's out in Ohio, and she'll finish up her PhD in psych. Okay, so it's important that you develop and offer nurture. You have to be good nurturers, and that means you have to be there. You have to be there. And Kathy and I, Baby Cakes, we were there for our children because our parents were there for us. Again, Baby Cake, she was my high school sweetheart, so I've known her 42 years. So when we were kids, we were together, and our parents knew each other, and our families were pretty much identical in the way we handled things. We were there together as a family unit. Even back then, we went and did things. So we raised our children the same way. Okay, it's very important. All right, we have 50 seconds left. Would you like to say something before we tune out?
Hi, Mom.
There you go. All right. Well, I want to thank you for being on show. You're going to be with me for the next few weeks, okay? Maybe a month or two. Get your hours in, and you can be able to put this on your resume and move on and nail a good job.
You're very lucky, Dr. O'Brien.
All right. So I want to thank everyone for listening. Like I said, this is a year now. Thank you for taking time and listening to my show. I really enjoy this, educating the community. Anyone can prescribe the pill, but it is the education behind that pill. It's knowledge is power. So to learn more about my practice, go to drtommyo.com. That's drtommyo.com, or call my office 631-980-8200.
The content heard on the Ask Dr. Tommy O show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.